Alright guys, let's talk about your gums. So I will be going over this image that I have right here and explain to you guys what I see on this image as a dental hygienist. So when we look at your gums, we mainly look at three different things. First is color. That tells us a lot. It tells us if there's inflammation, if your gums are healthy or not. Second is texture. The texture of your gums is going to show us if your gums are attached to your bones the way they should be or they're not. And then third is basically the shape of your gums. And that's also going to tell us if your gums are attached and if they're healthy or not. So let's go over the color first. So a healthy gum color is always going to look very pinkish. It's not going to have any red that it has like on this image. You can see in some areas especially it's getting like really red. And the way it looks. So that tells us that it's not healthy and there's a lot of inflammation present. So if I take my probe right now, which is just a measuring tool, and I go in here, and that's what we do when we measure your gums, we go in between your teeth like this, and we measure your gums. That kind of tells us how deep our tool is going to get in between your teeth and your gum. And the higher the number, the worse the gum health. So if I was about to take my measuring tool right now and go in between your teeth, it would have very high numbers if this was your situation and this is what your teeth look like. The second thing that I'm looking at here is how the gums are not firm and they're not flat. They're puffy. We call this bulbous. It's very puffy. It's very inflamed. It's probably going to bleed a lot when I poke here. And sometimes patients don't have it all over like this. Sometimes it's usually like maybe like in one area, and we call that a localized inflammation. Depending on if you have any bone loss or not, then it's going to either be gum disease or bone disease. And then usually if there's this much inflammation, it's most definitely bone disease, which is periodontitis. And if it's gum disease, then it's just gingivitis. So in this patient's case, they probably have like a stage 2 periodontitis, which is inflammation of bones, and his gums are affected too. There's only one way to tell for sure that they have what stage they are in, and that's only through looking at their x-rays, which I don't have right now. But just looking at this, the texture of their gums look bulbous, which we don't like. Normal, healthy gums are going to look flat. They're going to look firm. They're going to be attached to the bone and the tooth, and they're not going to look bulbous and puffy like this. So this is not good. And then something else that I'm noticing in this image is you see how like it's smooth and shiny. There's no texture. Usually healthy gums, normal gums, will have like an orange peel-like texture. And that's what shows us that, it's healthy. And why, even though like shiny and smooth sounds good, right? But it's actually not. Because the orange peel-like texture tells us that all of the little ligaments, the little like string-like attachments of your gums are kind of attached to the bone of your jaw, and it's holding your gums and your teeth basically together. So that's one way of for us telling that your gums are attached and they're healthy, and we can tell that from looking at the texture. So a shiny smooth texture like this is one of the other signs of your gums being unhealthy. And then something else that I look at is shape too. So you see that on this person's gums, you see how like the shape is like going everywhere and it's all around the place and it's not like uniform. Obviously, they've lost a lot of gum in this area, which we call recession. That's what we talk about when we call about recession. It's like when your gums are going way down, and it's going to eventually, once we remove all the plaque from in between their teeth, it's going to expose their roots if they lose more gum, and it's going to be very sensitive. So that's something else. It's not uniform. Normal or healthy gum shape is knife edge-like, and it's usually attached firm. It's going to go up and down like this, and then like a C shape up and down like this, and then it's just going to keep repeating. So they have lost like a lot of gum. Their gums should have been like up here, and in this area you can see that's how much gum they've lost. Like right here is probably a better presentation of what an almost healthy gum would look like, but this is bulbous, it's puffy. Make this flat and bring it up higher a little. That's how it should have been everywhere, but because they're losing gum, they're not in a healthy gum state. This is what's happening. So for a case like this, for a patient like this, the first thing we do is we numb them, right? Because this is going to be very painful to clean. We numb them. They're not going to feel any of the digging and cleaning and probing that we're going to be doing after. So after they're numbed, we take something called the ultrasonic. We go way deep under your gums, all around the tooth, here, also on the inside, everywhere, and we clean everything, all the gunk out. What that's going to do is basically going to give your gums a chance of trying to go back and reattach. That's something brilliant about our anatomy and the way our body works and our biology in general, is that our gums, if you clean these out and you have a healthy mouth, your gums are eventually going to go back and they're going to get firm and they're going to attach back to the teeth surfaces and the bone basically overall. And then after that step, we usually bring the patients back and then we check with our probe again to make sure that we haven't missed anything. You know, once we start cleaning this, there's going to be a lot of bleeding. The blood is just going to keep gushing out. And most of the time, you know, we do a pretty good job. We get like 99% of the stuff out. But if we miss like here and there one little spot, that's why it's important that you go back for your periodontal maintenance or your re-eval appointment, because that's when we check if we've missed anything in your deep cleaning appointments. So don't miss those. Don't be like, you know, I already had my deep cleaning, I don't need to go back. That's why we bring you back. After all of that's gone, imagine I'm cleaning all of this and there's so much bleeding and I took out like 99%, but there's 1% left, you know, maybe in like this little corner or spot or right here. I want you to come back so that I can get that too, so that you have a healthy gum attachment after your deep cleaning. Most of the time people will go, they won't come back for their reevaluation, and then when they come back, they haven't followed through all the post-op instructions, and they did not come back for us to re-eval the areas, and so that one localized area that still had buildup in it is now basically causing more inflammation in other areas, and it's just going to keep making the whole thing worse. And when you come back, you're like, oh, you didn't do a good cleaning for me, and you know, why do I still have like deep pockets? So please listen to your hygienist, your dentist when we tell you to come back or do something, because we know what's going to happen if you don't. So if you guys have any questions and you want more information, please comment. And also don't forget to share, like my posts. I share a lot of educational, dental, oral health in general content in my page, and I would really appreciate your support.